How long does it take for GLP-1 medication to leave your system? GLP-1 medications can take anywhere from about 12 hours to up to 10 weeks to clear from your system, depending on the specific medication and formulation you're taking. If you're using a GLP-1 medication for type 2 diabetes or weight management, understanding how long it stays in your body matters. It affects how you manage side effects, plan for medical procedures, and make transitions to other treatments if needed. Let's start with the basics. GLP-1 receptor agonists work by mimicking a natural hormone your intestines produce when you eat. These medications activate receptors throughout your body, particularly in your pancreas, digestive tract, and brain. In your pancreas, they help release insulin when your blood sugar is high, which means less risk of low blood sugar compared to some other diabetes medications. They also suppress a hormone called glucagon that raises blood sugar. Beyond blood sugar control, these medications slow down how quickly your stomach empties after eating. This helps you feel full longer. They also work on appetite centers in your brain to reduce hunger. That's why they're used for both diabetes management and weight management. Now, here's where the timeline gets interesting. Different GLP-1 medications clear from your system at very different rates. Short-acting formulations like exenatide, which you might know as Byetta, leave your system within 12 to 24 hours after your last dose. Liraglutide, sold as Victoza or Saxenda, takes about 3 days to clear. Long-acting versions stick around much longer. Dulaglutide, that's Trulicity, generally clears over about 3 to 4 weeks. Semaglutide, which is Ozempic or Wegovy, takes about 5 weeks to reach 97% elimination. Tirzepatide, that's Mounjaro or Zepbound, needs 4 to 5 weeks. By the way, tirzepatide is technically a dual GIP and GLP-1 receptor agonist, so it works on 2 hormone pathways instead of 1. And here's the longest acting option. Extended release exenatide, known as Bydureon, can persist in your system for 8 to 10 weeks after you stop taking it. That's because of its special depot formulation that releases the medication slowly over time. This wide range from hours to weeks comes down to something called half-life. That's the time it takes for half of the medication to leave your body. Generally, it takes about 5 half-lives for a medication to be mostly eliminated. A few factors can affect how quickly your body clears these medications. Your kidney function plays a big role for certain types like exenatide and lixisenatide. If you have kidney issues, these medications may stay in your system longer. Other GLP-1 medications break down differently throughout your body and aren't as affected by kidney function. So what happens when you stop taking a GLP-1 medication? Research suggests that blood glucose levels typically start rising within days to weeks after discontinuation. Your appetite will likely increase as the medication's effects on stomach emptying and hunger signals fade. The exact timeline depends on which medication you are taking and how long it takes to clear your system. If you're planning to stop your medication, this is definitely something to discuss with your healthcare provider. They can help you understand what to expect and whether you need a transition plan to another treatment. There are also specific situations where timing really matters. If you're planning to become pregnant and you're taking semaglutide, the prescribing information advises stopping at least 2 months before trying to conceive because of its extended half-life. This gives the medication time to fully clear your system. Confirm the timing with your prescriber for personalized guidance. For medical procedures, especially surgeries, tell your surgical and anesthesia teams what you're taking and when your last dose was. The delayed gastric emptying effect can be relevant for anesthesia planning. Follow their instructions and don't change your medication schedule without medical advice. Now let's talk safety. All GLP-1 receptor agonists carry an FDA-boxed warning about thyroid C-cell tumor risk. They're not appropriate for patients with a personal or family history of medullary thyroid carcinoma or a condition called multiple endocrine neoplasia syndrome type 2 or MEN2. If you experience severe abdominal pain, persistent nausea or vomiting, or any symptoms that concern you while taking or after stopping a GLP-1 medication, contact your healthcare provider right away. Here's what to remember. GLP-1 medications clear from your system anywhere from about 12 hours to up to 10 weeks, depending on the specific drug. Short-acting options like exenatide clear quickly, while long-acting versions like semaglutide and tirzepatide take 4 to 5 weeks. Extended-release exenatide can persist for 8 to 10 weeks. After stopping, expect changes in appetite and blood sugar control as the medication leaves your system. This video is educational and not a substitute for professional medical advice. Always consult your healthcare professional before making any changes to your medication regimen. They can provide personalized guidance based on your specific situation and health needs. Have you talked with your doctor about your GLP-1 medication timeline? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.